All right, we're live.
All right. Well, hello, everybody. I'm Sally, and this is Ross, and we're your counseling team here at SPSCC. Coming to you with another video about how to be coping at this time of year. And Ross and I just recently have been having a conversation about what a challenging time it is right now. COVID restrictions continue. It's the middle of the quarter. We're also experiencing, continued upheaval socially in our country. And now we've got winter coming on. And I've really been feeling that the lack of daylight recently. And I know, Ross, you had some good suggestions, and you have such great information about how light impacts our mood at this time of year, specifically in the Pacific Northwest.
Yeah, I've been feeling the same. My energy level has gone down. My mood feels a little bit more fragile, and really common this time of the year at this latitude, meaning this far up from the equator. Right around Halloween, every year, the days get short enough and the intensity of light, even during the day, gets low enough that many people start having some seasonal dips in mood and energy. And those can range from pretty serious dips where it's interfering with someone's functioning and causing a lot of suffering. Sometimes that's referred to as seasonal depression or seasonal affective disorder. Others can just experience kind of a subclinical dip, sometimes known as like the winter blues, that is not quite as serious, but still problematic.
Yeah, I'm definitely feeling that the winter blues. Like, I can tell my energy, even my motivation. It's affecting my motivation.
Yeah, absolutely. And so important for students because the quarter marches on regardless of your level of motivation. And so we wanted to talk a little bit to folks today about, the good news about seasonal mood dips and energy dips is they're actually very treatable. They're very treatable and fairly inexpensively, as treatments go. So to understand how to treat them, it's important to know just a little bit about what causes it.
Yeah, I think that would be great if you could give info about like what's happening physiologically to help students recognize this isn't about just mood or willpower or something has shifted in your character about motivation, that there's physiological things that are happening that are causing this.
Absolutely, yeah. It's starting in the body, really, in the body and the brain. It's not an issue of will. So it has to do with light, the intensity of light, and especially the intensity of light in the morning. So research on seasonal depression, tracks our circadian rhythms. These are kind of cycles, hormone cycles that are influenced by light and light dark cycles during the day. So when we get to this time of year, we wake up. The light we get in our eyes, and that's where it matters. Doesn't matter so much on your skin in terms of this hormone cycle. It's what gets in your eyes.
It's really got to be here.
It's got to be here, yeah. So that has to be of a certain intensity in order to affect one particular hormone called melatonin. And people have probably heard of that. Sometimes people will take melatonin capsules at night to sleep.
Right.
It's a hormone that goes through our whole body and our brain, and it causes drowsiness, sleepiness, low energy. In the morning, when we get bright light, like in the summertime, our levels, they drop to the floor. And we want that because we want to wake up, be alert, move through our day. But in the winter, at least here, the light isn't intense enough to drop them to the floor. So they can linger at a kind of a mid-range level all through the morning, even into the afternoon. And it leads to, some of the symptoms we're talking about.
So if I get that right, some of the sluggishness that I'm feeling in the morning is because my melatonin levels, rather than dropping with bright sunlight, are staying a little higher because the light is so dim. And then that higher level of melatonin in my system is prompting me to feel more sluggish and my mood to feel lower, like throughout the day.
Yeah, you got it.
Yeah.
Absolutely. And it's purely hormonal, just like if you took melatonin pills at night and you're feeling sluggish afterwards, you know why. It has nothing to do with willpower. It's because of a hormone.
And so what can what can students do? Can we control? What can we do to affect that melatonin level and get it to drop?
Yeah, so the main treatment is bright light exposure in the morning. So first thing on waking. That's important because sometimes people think, well, maybe I should do it later in the day. No, you got to get it right when you wake up to kick those levels to the floor of melatonin. And the level of exposure needs to be quite a bit brighter than, just normal house lamps. So
it's not just turning on all the lights in my house in the morning.
Yeah, I mean, it doesn't hurt to do that, but usually there's a measure of light called lux, L-U-X, and the amount of lux you need is 10,000 lux, which is that's a very bright light. So generally, we refer people to a device that's designed for this. And I'm showing two on the screen here.
Great.
The Luminet. Maybe a little bit hard to see here, but it's a visor. And the nice thing about the Luminet visor is you can go about your morning routine and get your light exposure about 20 minutes in the morning, 20 to 30 minutes.
Great. So it's not just a matter of laying the way maybe we're seeing this woman in the slide is laying down with the visor, but you could move around with the Luminet.
Absolutely. Yeah, you could, probably not take a shower with it, but, as long as things are dry, you can do your morning routine. Yeah,
get kids breakfast, get them ready for their online learning before I go into my Canvas classroom, that kind of thing.
Absolutely. And that's why I like that one the best. It's just the most practical, and it's a really nice, high quality device. The alternative, the Philips Go Light Blue, that's been around for years and works really, really well too. But as you can see, it's a desktop unit. So you'd have to have it close to you. Can't just be off in a corner. It has to be close to your eyes so it's getting in there. And then you're going to have to sit. And maybe, you can read while you're being exposed to the light or do computer work, but you're going to have to be stationary. So
the exposure, like this type of light, it's a specific level and a specific type of light, which is simulating the sunlight that we're not getting right now. That gets into my eye, and then that's going to trigger my hormone level of melatonin to drop to the levels that it should be at during the day. And then I'm going to feel kind of an uplift in energy and mood.
Yep. And usually with light treatment, you'll feel maximum benefit in about 2 weeks. So with the Luminet device, and I think it may be with the Philips, they have a 30-day return policy, so if you had the money to purchase one, you can try it, especially the Luminet, for 2 weeks. You should get maximum benefit by 2 weeks. And if you're not getting benefit, then you can always, return it.
What would you suggest? This is great to know about the light therapy and that there are things we can do to impact our melatonin levels. What about, I'm thinking about for students that maybe are looking at the prices right now of, say $150 or $80 and that maybe isn't affordable for them. So what are some alternatives? What else can students do if they're not able to maybe get that light therapy? What else would you suggest?
Yeah, well, and so the light therapy is the primary treatment for this because it's what really affects that hormone level. But you can do other things that are low or no cost that affect kind of other systems related to that low energy or depressive experience. So one is getting some exercise. And by exercise, I don't mean becoming an Olympic athlete. I mean, the research around exercise for mood and energy says pretty clearly across lots of studies, you need about 20 to 30 minutes a day of continuous purposeful movement. So like walking with a purpose, not just kind of sauntering down the path, but really kind of walking, not speed walking, just walking with a purpose, and keeping that consistent for about 20 to 30 minutes a day. So that is something that has good research behind it to say that will help with mood and energy.
So important to remember, and even during these days where it's rainy or gray out and we might not be motivated to really get outside and walk, that there's a real physiological benefit to getting outside and walking, that the movement is going to help.
Yep. And it's not something you can compensate for by, changing your thinking or something like that. What we're talking about is your physiology. So I really, given the research on exercise, it's reasonable to think of it analogous to a medicine. That 20 or 30 minutes is like a dose of medicine, and that affects your physiology in a really measurable way.
Yeah, what I'm hearing in that is if you could write a prescription for, say, a student out there who's experiencing some low mood right now and maybe seasonal affective disorder, if you could write a prescription on a pad that said 20 minutes of walking outside every day, you would do that.
I would write it for sure.
Yeah.
For sure.
Yeah.
Yep.
Yeah.
So, and again, one thing I would encourage students to think about if they're not inclined to do that, is to make it as fun as possible. There's no need to, it's not a no pain, no gain kind of situation. It's the more fun it can be, the better. So if you can get on the phone and chat with someone while you're walking, and that makes it more fun. I've had students, they play Pokemon Go as a way to motivate themselves out and moving, as long as it's continuous and with a purpose.
You'll or if you have a pet that needs to be walked, if you have a dog, that's a great reason to get outside, or walking with somebody in your household, a family member. And sounds so important. Did you also want to say anything about vitamin D and whether that would be recommended also? Yeah,
so this is a little bit different physiological mechanism, but it has to do with light. So at this latitude, again, this far up from the equator, in the winter, days are so short and intensity even during the day of light is so low that we cannot synthesize, we can't make vitamin D in our skin from light exposure. So a lot of people don't realize, just from sunlight, if the correct intensity, our skin will make vitamin D, and it's healthy for us. But when things get low light like this, literally our bodies cannot produce vitamin D from the sun anymore. And that leaves us, the only way to get it is to ingest it. It's from our food. It can be a little bit challenging to get enough vitamin D from our food only, without the benefit of the synthesis from our skin. And so lots of folks at this latitude supplement with vitamin D pills. It's really important to talk with your medical provider before supplementing. They can do a blood test and tell you, where are your levels and, whether you're low or not. But in consultation with them, if you do have low levels, you can take vitamin D. Excuse me.
And so, I see it's vitamin D3.
It's D3, so that's the most common. You'll see it out in, even like Trader Joe's or Walgreens. You don't have to go to a fancy store for this. And it comes in little like gel caps, vitamin D3 rather than D2. The Institute of Medicine lists 4,000 international units, IU a day, as upper limits for adults. That said, a psychiatrist that I really respect, when she talks with her patients about vitamin D, she usually suggests they take 5,000 to 10,000 international units a day. And so now this is not medical advice that we're giving. This is just educational. So I would encourage you to talk with your medical provider about this, because you can overdose on vitamin D. You can get too much, but supplementing is a really helpful thing for most of us, starting right around now, before Halloween. Just the beginning of October is a good time to start.
Yeah. So this could be a good time to maybe have an appointment and get some blood work done if you can, with a medical provider, to see if the vitamin D3 would be helpful.
Yeah.
And
Absolutely.
and then beyond that, maybe looking into the light therapies, and then also that 20 minutes of exercise. We can't write a prescription for the vitamin D3, but we can write a prescription for the walking and the movement.
Absolutely.
Yeah, yeah.
Yep.
Well, thanks for this, Ross. It's super helpful, and I hope it's helpful for all of you as students. And please keep us in mind here in counseling. You can reach us either about this topic or any other topics to transform your mental health to mental wealth is what we're shooting for. And you can reach us at counseling@spscc.edu.